Another concern high on the Liberals' agenda and weighing heavily on the minds of Canadians is the acute staffing shortages that are plaguing the healthcare system in this country. And the lack of available staff now has provinces actively poaching from each other. The latest example from New Brunswick. And let's bring in Natalie Collada with the details on where New Brunswick is looking.
Well, this is interesting, Heather, because they are looking at Quebec. Horizon Health held a hiring event in Montreal this week in the Montreal area, offering a barrage of bonuses and benefits to try and attract nurses, I should say. They also released a promotional video as part of the campaign and are including promises of up to $10,000 in signing bonuses and up to $5,000 in relocation costs, promising as well to help find partners, employment in a new province if they make the move. The health network saying that the first 120 applicants will receive customized treatment and help them move towards, make that move to New Brunswick, including, as we said, covering moving expenses and helping partners find work. Now, Carrie Kennedy is the Director of Talent Acquisition for Horizon Health. She says that the Montreal event was not a job fair, but was really targeting nursing candidates who had already expressed interest in working in New Brunswick. Have a listen.
So it's a customized approach. It's tell us what is challenging for you in making that move, what's holding you back. You know, you've expressed interest to us over the last year. So what does that look like, and what can we do to help you with settlement into our province? For some new to the province and for some repatriating back. So we offer incentives that are numeric, but also a customized support with them. So there's a dollar value attached to that. You know, there's a $10,000 incentive for hard to recruit positions.
Now, that said, when CBC reporters attended the Quebec Horizon Health event, no nurses had arrived to meet recruiters, but we do know that this is something they are actively trying to do. Heather?
So what does Quebec think about all this?
So this is interesting. Quebec is among the provinces also dealing with the nursing shortages. In a statement, the province's health minister said this. He says it is in everyone's interest to recruit personnel from abroad. We have some great examples here in Quebec of nurses from around the world who are making a difference. In the meantime, we will continue to work to make our network of employers of choice and improve working conditions. But we are hearing things in Quebec and in many other provinces as well, where mandatory overtime is becoming very common in hospitals, with some experts wondering if perhaps poaching nurses from other provinces isn't the best way to solve the problems. Perhaps there's something else they can do. Have a listen.
Fortunately, everyone focuses on recruitment and not the important issues of retention. And we need to have all of those health workers. And this isn't just nurses, it's physicians, it's midwives, it's respiratory therapists, radiation technologists, like all of these folks are all completely burnt out. And we have trouble recruiting in all of those positions, and it's destabilizing the system. If one member of the team is, not there, you can't go ahead, with the surgery, right? You need a team.
So instead, experts are also saying, reducing pressure on hospitals would be more beneficial, including protecting nurses from illness, protecting their mental health and work-life balance, and instead of focusing on recruitment, focus on retention and making it attractive as well to the employees that you do have. Also part of the problem that needs to be resolved. Heather?
Natalie Collada, thank you very much.